This week is Cervical Cancer Prevention Week, and it's a good time to remind ourselves of the importance of having a smear test and having that smear test regularly. Let's face it, none of us really like going to have a smear test. It can make us feel vulnerable, and often life gets in the way and our own health needs are put on pause. But it's really important to go for these tests because what the test can do is it can identify early changes in the cervix which could lead to cervical cancer. The test is relatively quick and relatively painless, and what happens is that we are looking for the commonly occurring virus called human papillomavirus, or HPV. HPV is the virus that can cause some women to develop cervical cancer. So the smear tests aim to identify that. And we know that cervical screening can prevent around 7 in 10 cervical cancers, so it's a really good screening test. It's really important to go for these tests even if you're perimenopausal or postmenopausal, and if you have symptoms of vaginal dryness or pain around your vagina, it can be useful to use some vaginal estrogen in the weeks preceding your test to make the test a bit more comfortable. In the UK, we offer these tests to women between the ages of 25 and 64. Don't worry if you've missed your appointment or you haven't responded to your letter. Just get in touch with your practice or your practice nurse as soon as you can to rebook the appointment, and don't put that on hold. The smear test itself is usually taken by your practice nurse and involves inserting something called a speculum, which is often plastic, into the vagina to view the cervix, which is the neck of the womb. Once we've viewed the neck of the womb, we take a small brush and we brush the neck of the womb to get some cells and to retrieve the cells to send to the lab. It's looking at these cells that will identify any changes, and this is really what a smear test entails. It can be a little bit uncomfortable to have the speculum inserted, but your health professional will use a little bit of lubrication to aid its insertion. And if you feel uncomfortable at any point, just let your doctor or nurse know and they can stop the test. In terms of making the test more comfortable, some women find that lying on their back with their hands underneath their bottom can help. Some women find that lying on their side can also be really helpful as well. Taking slow, deep breaths during the procedure can also really help. The whole test probably only lasts a minute or so, so it's over really, really quickly. It can be slightly uncomfortable, but it shouldn't be painful. So as I said before, if it is, just let your nurse know and they can stop. Sometimes it can be helpful to play soothing music or wearing a longer skirt so that you don't need to undress entirely when you go for your smear. As I said at the start, it can make us feel a little bit vulnerable, so there's small things that you can do to aid the smear test happening. But please don't forget to go. Most women need a smear test every 3 years, and after the age of about 49, every 5.